After years of slowing progress, new HIV infections fall sharply in San Francisco. A worrying rise in the Latino community was reversed in 2023, likely due to more outreach and injectable medications. The number of people newly diagnosed with HIV in San Francisco dropped by 20% in 2023 to 133, the lowest in decades, and a significant decline compared to an adjusted total of 167 in 2022, according to an annual HIV epidemiology report released Monday from the Department of Public Health. It marks an improvement from recent years, when new infections were flat or declined less than they had in previous years, signaling a slowdown in progress. At the peak of the AIDS epidemic in the late 1980s and early 1990s, about 2,000 people were diagnosed each year in San Francisco. This is certainly an all-time low for the last several decades, said Dr. Stephanie Cohen, director of the HIV and STI Prevention and Control section of the Public Health Department. The most striking and most encouraging trend of 2023 was a 46% drop in new diagnoses among Latino residents, who in 2022 had experienced a worrying rise in new infections, Cohen said. That was quite a sharp reversal of the concerning trend we'd seen in the prior year, she said. Cohen attributed the drop to a few factors. Health officials worked with community groups to set up new health access points for HIV and STI prevention and treatment, including one to reach the Latino community in the Mission neighborhood. Moreover, in 2023, there was a major expansion in the number of people using long-acting injectable medications to prevent and treat HIV, Cohen said. The long-acting medications offer people an alternative to taking a daily pill for pre-exposure prophylaxis. The antiviral drug cabotegravir, also known by the brand name Apretud, is given every 2 months to prevent HIV. The combination of cabotegravir and rilpivirine, known as the brand name Cabenuva, is given once a month to treat HIV. Both products were approved in 2021, but because it took time for health systems to integrate the new products, there was greater uptake in 2023 than in the preceding 2 years, Cohen said. It's not clear how many more people are taking the new drugs citywide. But at San Francisco City Clinic, the sexual health clinic run by the Public Health Department, the number of patients taking cabotegravir jumped from just 3 in 2022 to 68 in 2023, according to the report. The number of people ordering at-home test kits for HIV and sexually transmitted infections also rose in 2023 to 1,026, up 66% from 619 in 2022. The test kits come from Take Me Home, a program launched in March 2020 to encourage people to test at home. The report showed 15,544 people living with HIV in the city in 2023. About 69% are men 50 years and older. The majority of new HIV diagnoses in 2023 were among cis men who have sex with men. But a growing proportion of new diagnoses were among cis women, trans women, and trans men. This reflects a need to reach all populations who are at risk for HIV, Cohen said. It's not that the numbers are going up in those populations, she said. The problem is they're not going down as fast as they are among gay, bisexual, and other men who have sex with men. We need strategies to reach those populations where we're not seeing the declines. We need to be reaching everyone who's at risk for HIV or living with HIV.